Hey Demi, I'm at work, so if somebody calls, I'll probably have to stop, but that's okay. I'm doing Mosbys, and we're doing neuromusculoskeletal starting on page 295. Number 467. A nurse is planning to transfer a client who is experiencing pain from the bed to a chair. Place the following steps in the order in which they should be implemented. First, verify the client's activity order. Second, identify factors that may impact the ability to transfer. Third, explain the steps of the transfer. Fourth, ensure that wheels on the bed are locked. And 5, position the client in functional body alignment before transferring. 468. A nurse identifies which clinical indicator of parasympathetic dominance in a client under stress. 4, increased gastrointestinal secretions. 469. During an annual physical assessment of a client reports not being able to smell coffee in most foods. Which cranial nerve function should the nurse assess? Number 1 is your olfactory. 470. Which clinical indicator does the nurse identify when assessing a client with hemiplegia? Paralysis of one side of the body. 471. The school nurse is attending to a student athlete who reports muscle pain after a practice session. What should the nurse identify as the cause of this pain when providing instructions to the student? Lactic acid. 472. We don't need to know that one. 473. When completing a neurological assessment, the nurse determines that a client has a positive Romberg test. Which finding supports this nurse's conclusion? Inability to stand with feet together when eyes are closed. 474. When caring for a client with a head injury that may have involved the medulla, the nurse bases assessments on the knowledge that the medulla controls a variety of functions. Which ones apply? Select all that apply. The medulla controls breathing, pulse rate, and blood vessel diameter. 475. When performing a neurologic assessment of a client, a nurse identifies that the client has a dilated right pupil. The nurse concludes that this suggests a problem with which cranial nerve? The third cranial nerve. 476. A nurse is assessing a client whose mouth is drawn over to the left. The nurse should consider damage to which cranial nerve to be the most likely explanation for this clinical finding? 1. Left facial nerve. 477. After a brain attack, a client is unable to differentiate between heat or cold and sharp or dull sensory stimulation. What lobe of the brain should the nurse conclude is likely affected? 2. Parietal. 478. A client experiences a traumatic brain injury. Which finding identified by the nurse indicates damage to the upper motor neurons? 4. Babinski response. 479. A nurse is caring for an anxious, fearful client. Which client response indicates sympathetic nervous system control? Skin pallor. 480. When transporting a client on a stretcher, the nurse makes certain that the client's arms do not hang down over the edge. To which nerve plexus does the nurse avoid injury in taking this precaution? Brachial. 481. The nurse assists the healthcare provider to perform a lumbar puncture. When pressure is placed on the jugular vein during a lumbar puncture, the spinal fluid pressure is expected to increase. Which sign should the nurse expect the healthcare provider to document? And it is Queckenstedt. 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 42. A client has a craniotomy for a meningioma. For what response should the nurse assess the client in the post-anesthesia care unit? Blurred vision. 483. A client is to have a computed tomography scan with contrast to assess a potential brain tumor. The nurse should teach the client what common expected responses to the contrast material. Flushing of the face and sensation of warmth. 484. A nurse is monitoring a client who is having a CT scan of the brain with contrast. Which response indicates that the client is having an untoward reaction to the contrast medium. Shortness of breath. 486. A client is admitted with paresis of the ciliary muscles of the left eye. What function should the nurse expect to be affected? Focusing the lens on near objects. It's kind of a weird question, but you never know what she's going to ask. So, 492. A nurse performs a Rhine test during physical assessment of a client. The client indicates that the sound is louder when the vibrating tuning fork is placed against the mastoid bone than when held closely to the ear. What conclusion should the nurse make about these results? This is evidence of conductive hearing loss. 496. What clinical indicator does the nurse expect to identify when assessing a client with a brain tumor in the occipital lobe? Visual hallucinations. 498. A client who is receiving Dilantin to control a seizure disorder questions the nurse regarding this medication after discharge. The nurse's best response is, "This medication will probably be continued for life." 499. A client with a history of seizures is admitted with a partial occlusion of the left common carotid artery. The client has been taking Dilantin for 10 years. When planning care for this client, what should the nurse do first? Obtain a history of seizure type and incidence. 500. When entering a room on a medical unit, the nurse identifies that a client is having a seizure. What should the nurse do in addition to protecting the client from self-injury? Monitor the seizure activity. 502. What is the primary responsibility of a nurse during a client's generalized motor seizure? Clearing the immediate environment for client safety. 503. A client who has a history of seizures is scheduled for an arteriogram at 10 a.m. and is to have nothing by mouth before the test. The client is scheduled to receive an anticonvulsant medication at 9 a.m. What should the nurse do? Ask the healthcare provider if the drug can be given IV. 504. Several clients are admitted to the ER with brain injuries as a result of an automobile collision. The nurse concludes that the client with an injury to which part of the brain will most likely not survive? The medulla. 505. After sustaining a head trauma, a client reports hearing ringing noises. The nurse considers that an injury to what part of the body is likely to cause this clinical indicator? The 8th cranial nerve, which is also known as the vestibulocochlear nerve. 506. A nurse should expect to identify a loss of which ability when assessing an unconscious client? Controlling elimination. 507. The neurologic assessment of a client who had a craniotomy includes the Glasgow Coma Scale. What does the nurse evaluate to assess the client's score on the Glasgow Coma Scale? Select all that apply. Degree of purposeful movement by the client, appropriateness of the client's verbal responses, and stimulus necessary to cause the client's eyes to open. 508. A client regains consciousness and has expressive aphasia. What should the nurse include as part of a long-range planning for this client? Provide positive feedback when the client uses a word correctly. 509. Soon after admission to the hospital with a head injury, a client's temperature increases to 102.2 Fahrenheit. The nurse considers that this client has sustained injury to what structure? The hypothalamus. 510. What action should the nurse take when caring for a client who has a possible skull fracture as a result of trauma? 1. Monitor the client for signs of brain injury. 511. A nurse is assessing a client with a brain tumor. Which clinical findings indicate an increase in ICP? Select all that apply. 1. Fever and 2. Stupor. 512. What therapeutic effect does the nurse expect to identify when mannitol is administered parenterally to a client with cerebral edema? Decreased ICP. 513. A client had a craniotomy for excision of a brain tumor. After surgery, the nurse monitors the client for increased ICP. Which clinical finding supports an increase in ICP? Lower level of consciousness. 514. When caring for a client who had sustained a head injury, it is important that the nurse assess for which clinical indicator? Slowing of the heart rate. 515. A client develops hydrocephalus 2 weeks after cranial surgery for a ruptured cerebral aneurysm. The nurse concludes that the hydrocephalus probably is related to which physiological response? Blocked absorption of fluid from the arachnoid space. 516. What should the nurse assess for in the immediate post-op period after a client has brain surgery? Decreased level of consciousness. 517. What nursing action is essential when a client experiences heminopsia as the result of a left ischemic stroke? Place objects within the visual field. 518. During a health fair, the nurse takes an adult's blood pressure and it is 200/120. The nurse should base the next nursing intervention on the understanding that there is an increased risk for having a brain attack. 519. Which health problem does the nurse identify from an older client's history that increases the client's risk factors for a brain attack? Transient ischemic attacks. 520. Which clinical indicator is the nurse most likely to identify when assessing a client with a ruptured cerebral aneurysm? Sudden severe headache. 521. A client with a brain attack is comatose on admission. Which clinical indicator is the nurse most likely to identify? Urinary incontinence. 522. In which position should the nurse initially place a client who has experienced a brain attack? Lateral. 523. The family members of a client with a diagnosis of brain attack express concern that the client often becomes uncontrollably tearful during their visits. What should the nurse include in a response? Emotional lability is associated with brain trauma. Oops. Sorry, Debbie. Okay. 524. Which function must be addressed in the plan of care when a client has dysphagia? Swallowing. 525. A client with a brain attack has dysarthria. What should the nurse include in the plan of care to address this problem? Effective communication. 526. A client with a brain attack has right hemiplegia. What occurs if the nurse uses the client's right arm to obtain a blood pressure reading? 1. Produces inaccurate readings. 527. Bed rest is ordered for a client's brain attack results in hemiplegia. What? Okay, sorry. Bed rest is ordered after a client's brain attack results in hemiplegia. Which exercises should the nurse incorporate into the client's plan of care 24 hours after the brain attack? Passive range of motion exercises. 528. Which clinical indicators does the nurse identify that suggest that a client is experiencing urinary retention and overflow after a brain attack? Frequent voidings and suprapubic distension. 529. A client has left hemiplegia because of a brain attack. What can the nurse do to contribute to the client's rehab? Position the client to prevent contractures. A client had a brain attack and bed rest is ordered. What can the nurse use to best prevent foot drop in this client? Splints. 531. What is the maximum amount of time the nurse should allow an older adult with a brain attack to remain in one position? 1 to 2 hours. You just sent me a text. Thanks, Debbie. 532. A client with hemiparesis is reluctant to use a cane. The nurse explains to the client that the cane is needed to maintain balance to improve stability. 533. On which principle should a nurse base client teaching when planning to assist a client to re-establish a regular pattern of defecation? Peristalsis is initiated by the gastrocolic reflex. 534. A nurse may find that, for optimum nutrition, a client with a brain attack needs assistance with eating. What should the nurse do? Encourage the client to participate in the feeding process. 535. A client with a brain attack becomes incontinent of feces. What is the most important nursing action to support the success of a bowel training program? Adhering to a definite time for attempted evacuations. 536. A nurse is caring for a client who has urinary incontinence. A nurse is caring for a client who has urinary incontinence as the result of a brain attack. What action should the nurse include in the plan of care to limit the occurrence of urinary incontinence? Institute measures to prevent constipation. 537. The spouse of a client who had a brain attack seems unable to accept the concept that the client must be encouraged to participate in self-care. What is the best response by the nurse? Ask the spouse for assistance in planning those activities most helpful to the client. 538. The spouse of a client with a brain attack insists on doing everything for the client during visits. After these visits, the client seems to be depressed. The nurse understands that these visits probably have what effect on the client? Feeling the loss of independence. 539. A client is diagnosed as having expressive aphasia. What type of impairment does the nurse expect the client to exhibit? Speaking and/or writing. 540. What action should the nurse include when planning for the long-term care of a client with expressive aphasia? Begin helping the client to associate words with physical objects. 541. Which nursing action is specific to the plan of care for a client with trigeminal neuralgia? Be alert to prevent dehydration or starvation. I don't think we really need to know that, but whatever. 576. A nurse finds a victim under the wreckage of a collapsed building. The individual is conscious, supine, breathing satisfactorily, and reporting back pain and an inability to move the legs. Which action should the nurse take first? Leave the individual lying on the back with instructions not to move and seek additional help. 577. After a client is treated for a spinal cord injury, the healthcare provider informs the family that the client is paraplegic. The family asks the nurse what this means. What explanation should the nurse provide? Lower extremities are paralyzed. 578. A client with a spinal cord injury has paraplegia. The nurse assesses for which major problem that the client may experience early in the recovery period. Bladder control. 579. A nurse should expect a client with a spinal cord injury to have some spasticity of the lower extremities. What should the nurse include in the plan of care for this client to prevent the development of lower extremity contractures? Proper positioning. 580. A client has paraplegia as a result of a motorcycle accident. What is the reason the nursing care plan should include turning the client every 1 to 2 hours? Prevent pressure ulcers. 581. What problem is the nurse primarily attempting to prevent when encouraging a client with a spinal cord injury to increase oral fluid intake? Urinary tract infections. 582. A client has a functional transection of the spinal cord at C7/8, resulting in spinal shock. Which clinical indicators does the nurse expect to identify when assessing the client immediately after the injury? Select all that apply. Flaccid paralysis and lack of reflexes below the injury. 583. After a traumatic spinal cord severance, a young client is having difficulty accepting the paralysis. One day, the client has severe leg spasms and says, "My strength is coming back and I know I will walk again." The nurse's response should be based on what understanding? Spinal shock has subsided and the client's reflexes are hyperactive. What should the nurse assess for when a client with a cervical injury reports a severe headache and nasal congestion? Suprapubic distension. This is a big deal. That's autonomic dysreflexia. 585. A client with quadriplegia is placed on a tilt table daily. Each day, the angle of the head of the table gradually is increased. What should the nurse identify as its purpose when the client asks the reason for the tilt table? It limits loss of calcium from the bones. $5.95. A client experiences a traumatic amputation of a leg in a motor vehicle accident. Which nursing intervention initially should receive the lowest priority? Teaching of residual limb care. 612. What does the nurse determine is the most likely cause of renal calculi in clients with paraplegia? Accelerated bone demineralization. 613. A client who has been immobilized for an extended period questions the need for a tilt table. The nurse's best response is, the tilt table is used to help prevent loss of calcium from long bones. And that's it. All right, hope that helps, and I'll probably come back with the rest of Lippincott later.